Did you know that a new virus has started spreading, and it could affect you and your loved ones? That's right, today we're diving into the Hmpv virus outbreak, a less talked about but potentially dangerous virus. As we become more aware of different viruses, understanding Hmpv is crucial. This virus might not be making headlines like others, but it's still important to know about it. So, why should you care about the Hmpv virus? Let's explore what it is, how it spreads, and what you can do to protect yourself. First, let's talk about what Hmpv is. Hmpv stands for Human Metapneumovirus. It is a virus that mainly affects the respiratory system. You might experience symptoms similar to the common cold or flu. These can include cough, fever, sore throat, and runny nose. In some cases, it can lead to more severe symptoms, especially for young children and the elderly. Now let's discuss how this virus spreads. Hmpv spreads through respiratory droplets. When someone who is infected coughs or sneezes, tiny droplets containing the virus are released into the air. You can also get it from touching surfaces that have the virus on them and then touching your face. This means keeping your hands clean is incredibly important. So, how can you recognize the symptoms of Hmpv? Typically, symptoms start appearing about 3 to 5 days after infection. You may have a persistent cough and a runny nose. Some people report feeling fatigued and have shortness of breath. It's essential to monitor these symptoms, especially if you or someone around you has a weak immune system. Now, let's dive into prevention. What can you do to protect yourself and your family from Hmpv? Firstly, practice good hygiene. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water aren't available, use hand sanitizer with at least 60% alcohol. Next, avoid close contact with anyone who is sick. If someone in your home is showing symptoms, try to maintain some distance. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Afterwards, wash your hands immediately. Another critical aspect of prevention is keeping surfaces clean. Regularly disinfect commonly touched surfaces like doorknobs, light switches, and your phone. Good ventilation also helps. Open windows when possible to let fresh air circulate in your living space. Now, let's talk about treatment. If you suspect you have Hmpv, what should you do? There is no specific antiviral treatment for Hmpv. Most people will recover on their own with plenty of rest and fluids. Over-the-counter medicines can help with symptom relief. For fever or aches, consider taking acetaminophen or ibuprofen. If your symptoms worsen or you're having trouble breathing, seek medical attention immediately. It's always better to err on the side of caution. Let's not forget the importance of vaccinations. While there isn't a vaccine specifically for Hmpv, staying up to date on your flu shots and other vaccines is important. These vaccinations help your immune system remain strong against various viruses. Speaking of which, let's get a little interactive. Have you or someone you know experienced Hmpv or any similar symptoms? Share your stories or any tips you've learned in the comments below. Your experiences could help others in our community. And don't forget to like this video if you found this information helpful. Outro. To wrap things up, the Hmpv virus may not be as commonly discussed, but it's important to be aware. Practice good hygiene, keep your environment clean, and monitor your health. In times like these, staying informed is one of the best ways to protect ourselves and our loved ones. Remember to stay safe, stay healthy, and share this knowledge with others. Thanks for watching, and we hope you learned something useful today.